back with Tuesday Tips. This is our weekly check-in. We go over different topics in plastic surgery and I answer your questions. And today I'm going to discuss a very, very hot topic right now after the recent post in our social media about BMI. And what is it? Why different doctors have different BMI requirements? What is my BMI requirement and why? So let's go over this and then I get to answer your questions. So what is BMI? BMI is the body mass index. So it's a calculation, a formula that takes into consideration weight and height. And why this is important? Because we're trying to stratify everyone into a weight classification. Obviously saying that different people have different weights is not enough. We have to take into consideration their height. And yes, BMI has its limitations. Like any other formula in medicine or life, it has its limitations. Regarding muscle mass, bone mass, ethnicity, and that's why we have ranges, right? We don't look at one number, but we have ranges to take into consideration those limitations. And something that people always tell me, oh, but I have more muscle mass, I have this. Still, if you are over that certain number, you are at higher risk. And why do we know this? Because there's been a lot of studies looking into surgical risks and BMI levels. And this is not only in plastic surgery. This is all along and all surgically related. You know, orthopedic surgery, general surgery, neurosurgery, cardiothoracic, plastic surgery, looking into complications related to BMI. And that is why it's so important to get to your goal BMI that your surgeon wants you to, and why some surgeons simply don't do surgery above X or Y BMI, okay? So what does, after we get this number, right, we put it, and the easiest way, just go in Google and put BMI calculator. It'll pop up a window that you literally put your height and weight and it does it for you, okay? You don't have to get a calculator and start, figuring it out. You Google BMI calculator, put in your numbers, and then you get a number. And what does this number mean? So this is what it means. So BMI less than 18 means you're underweight, okay? So you're not a candidate for surgery because you need to bring those proteins up, okay? If you are underweight, you are not in a healthy state to heal wounds, okay? Normal BMI is between 18 to 24.9. That is a normal BMI. And that's why it's a big range, because taking into consideration ethnicity, muscle mass, bone mass, different, complexions. So it's not two numbers, it's a wide number, okay? 18 to 24.9, that's normal. If you want a BBL, it's better to be in at least 21 to 22 BMI or upper, because we do need fat. People on the closer to 18 range are very thin and won't have enough fat to transfer, okay? So if you're interested in a BBL, it's better to be closer to the 24, so 22, 23, that's a better BMI goal if you're interested in a fat transfer. Overweight, 25 to 29.9, that's overweight. 30 to 34.9, we're in the classification of obesity, but it's obesity class 1. And then after 35 and above 40, we're into class 2 obesity and class 3 obesity. And this is no for surgery, elective surgery, right? We're talking about elective surgery. If you do need surgery for other reasons, it's different, right? And why is it important? Because with elective surgery, we are putting in comparison the risk and the benefits of the procedure. If you are in a BMI more than 35, the risks overweight the benefits. So there's no reason to you go under general anesthesia and then go through a recovery that the complications are going to be too high, which means that you probably will have a complication, okay? So not worth going to an elective procedure if your BMI is above 35. What things can you do? Meet with a nutritionist to calculate your caloric goals, okay? Meet with a personal trainer or physical therapist to work on a routine. Also, if you've tried all of this and it hasn't worked, there are other options such as medications that can help you reach that goal. It's important to go to, if you're in this classification, to go to an endocrinologist or a primary care physician that manages weight loss patients, and it can start you on different medications to try to achieve your goal, or a bariatric surgeon consultation to consider bariatric surgery to reach your BMI goal. Okay, those are basically the options if you're in an obese class 2 or 3. Let's talk about obese class 1. We've seen that different surgeons have the range of classification of BMI in between those numbers. And there are others that is like you have to be less than 30. Well, less than 30 is normal risk, okay? We don't have any increased risk, so if you're less than 30, your surgical risks are the same as a normal BMI, basically. So it's okay. I mean, it's not zero, it's never zero, right? But the risks are balanced like any abnormal BMI, so you can proceed with surgery. What about surgeons that are okay with doing obese class 1 patients? So this classification, and this has been studied in plastic surgery specifically. Why? Because in plastic surgery, we deal with massive weight loss patients, right? So we have to have a window. Those massive weight loss patients most of the time have a lot of excess skin, and the excess skin weights. And that contributes to having maybe that increase in weight that puts them a little bit higher than 30. And that is why I put my limit on 33.5. Why? I consider the transition of that excess skin. Sometimes they reach a weight loss and then they're stuck there because that excess skin is not only weighing on them, but also interfering with getting on the treadmill, moving around. So it's very hard for them to get lower than 30. And I understand that. What is the important part? That you understand that your risks are a little bit higher than if your BMI was less than 30. That if you can get your BMI to less than 30, it's even better. I recommend all my patients get less than 30 of a BMI. That's going to bring those surgical risks down. But I do understand that it's not a reality for every patient. So I'm willing to discuss the risk with the patient, knowing that they're a little bit higher than if they get it lower than 30. And also we do some things different to try to decrease that risk. What are those things? So let's talk about, I'm talking about the risk. So what are those risks? Mainly 3 things, okay? One is wound healing, okay? What is wound healing? Wounds open up, okay? Or the scars get thicker because the wound healing is affected. Number 2, infection, okay? I put every patient on antibiotics in the OR and then afterwards for a week. But if your BMI is higher, you are at an increased risk of wound infections. And the third and most important is risk of blood clots, okay? Blood clots in your legs or those clots traveling to your lungs, which is a pulmonary embolism. Why we talk a lot about this? Because this risk can be fatal, and that is why surgeons are so strict with the requirements of BMI and those post-operative things that we do to decrease this risk, okay? Because if blood clot in the leg, we can put you in blood thinners and it'll resolve. But if that blood clot travels to your lungs, it interferes with the blood getting oxygen, and it can be fatal. So it's a very dangerous complication, and that is why some surgeons don't like to have that risk and just don't put above 30 as even a possibility for their patients, okay? What do I do for patients that are above 30? For tummy tucks specifically, I put you on blood thinners, okay? I'm gonna put you blood thinners for 2 weeks and also give you a device that it's called a sequential compression device, or Circulate, or Venapro. All of those things mean the same thing, which is basically a device that you wrap around your calves, massages your calves, stimulates circulation to decrease the risk of blood clots. Every single tummy tuck patient gets this, or mommy makeover, because they're getting a tummy tuck. But if you're getting a tummy tuck and you're above 30 of BMI, I'm gonna give you that and blood thinners. And you would say, then why every surgeon doesn't do that, right? Like if you can put me in blood thinners, then put me in blood thinners. Well, there's the risk of bleeding, okay? Blood thinners thin your blood so you can have a hematoma, okay? And that can be very dangerous too. So it is all about knowing what are the risks and you making an informed decision. The reason, like I mentioned, why I do 30 to 33.5 is specifically for those massive weight loss patients that need that leeway. Every patient, I encourage them to lower it to 30 to decrease the risk, but there are things we do for the 30 to 33.5 to try to decrease it, okay? So I hope this helped. Let's get some questions.
Thank you, Doc. Okay. Mini tummy tucks recovery and benefits.
So a mini tummy tuck, what's a mini tummy tuck? A mini tummy tuck only excises skin, okay? So the candidates that are good for this procedure usually are, so every patient is not usually a candidate for a mini tummy tuck. A tummy tuck in general considers removing excess skin, repairs the muscle, and also repositions your belly button, okay? So if you do have a lot of excess skin, when you excise the skin only without repositioning the belly button, it may lower the belly button a little bit, okay? So if you do have a high belly button, and that depends on everyone's anatomy, you can tolerate having the belly button a little bit down because I release it from the abdominal wall, and by pulling the skin, it goes down a little bit. But if you do have a low rising and a lot of excess skin, then when I pull the skin, basically I have to reposition the belly button, and that makes the scar around the belly button, which is the regular tummy tuck. So the benefit obviously is to try to avoid that scar around the belly button and just leave it on the lower part. But like I mentioned, it's very small amount of patients are candidates for this because most of the patients that have that excess skin also have the muscle separation that needs to be repaired.
This is a question of YouTube. Do you put patients, 1 second please. Do you put patients who are both 30 on blood thinners who go in for the BBL lipo procedure?
Not for BBL lipo. For BBL lipo, there's a lot of what's called capillary bleeding. So remember that with liposuction, it's a cannula going in and out, and there's all those capillaries are bleeding after, and that your body can tolerate and control that bleeding with the clotting. So if we put you in blood thinners, the risk of that oozing or that capillary bleeding getting out of hand or getting more drain, it's higher. And the reason why I only do it in tummy tucks and not in the BBL lipo, it's because tummy tuck has the highest rate of blood clots, DVTPs, in plastic surgery. The reason for that is after tightening the abdominal wall, the muscle, and the skin, there's more resistance of the blood to circulate back to the heart. So that is why the risk of blood clots is higher. So, and that is why I put it for the tummy tuck patients that have a BMI higher than 30.
Okay, let's keep another question here at YouTube. And what's the best way to take the vitamins? The instructions in the box say items need to be taken with no food, folic acid with food. So how's the best way?
Yeah, so I mean, the differences are between some of the vitamins because the absorption, okay? So folic acid is better to drink with food because of the acidity of the stomach, okay? The best thing, the ones that without food, try to take them right, like put them in your nightstand with a little bit of water, and the first thing you do is drink those, and by the time you wash your teeth and you get dressed and then have breakfast, have enough time to then have the rest with your breakfast.
Okay, how do I choose a size for my breast lift without going too big?
So breast lift only, no implants, apparently. Okay, so choosing breast size it's more of I always say, don't focus on cup size, focus on look. So when you're looking at pictures to try to decide what is it that you like on a breast shape, don't focus on the volume, but focus more on the look. If it's very round, if it's perkier, if it's more of a teardrop or natural shape. Those things are going to be more important when you are discussing it with me in your pre-op appointment. The volume, it's going to depend a lot on your measurements and also the amount of breast tissue that you have. So cup size wise, how big you want to go, like say I'm a B and I want to be a double D. So sometimes if you want to go that big of a change, you'll need more than one surgery. And we can discuss that next week in more detail because it involves different things, the reduction, lift, implants. But it's better to focus on what shape you like, and then we can go over cup sizes goals.
But after an arm lift, can one use their arms to clean themselves when using the toilet?
The toilet, yes. So what I like to say to my patients is after a breast lift, breast aug, brachioplasty, you have T-Rex arms, okay? So try to keep your elbows close to your body, but you can definitely clean yourself up. You can shower, you can clean your face, your head too, but try to keep your elbows down. Try to keep your elbows below your shoulder. So up to here is okay. You shouldn't be trying to reach over like this.
How many days would I have to stay in Miami if my mommy makeover falls in middle of the week?
So always calculate post-op day 5. So your surgery days is 0. So post-op day 1 is the next day. So just count 5 days. If that 5th day is on a weekend, I'm gonna see you that following Monday, okay? And that's the day I need to see you. After I see you on post-op day 5, so for example, if you're having surgery Tuesday, right? Wednesday, Thursday, Friday, Saturday, Sunday. I'm not gonna see you Sunday, I'm gonna see you Monday, okay? If it's Wednesday, then it's fine. I'm gonna see you Monday and you can leave. But that flight, take it either at night, late in the afternoon or night, or the next day if you don't have available. Don't put it in the morning because it's gonna be very rushy, you're not gonna make it.
En español.
En español, la misma pregunta.
No.
Ah.
¿Cuántos tummy tucks se pueden hacer? En el segundo los resultados pueden ser óptimos también.
Todo depende de qué ha cambiado y por qué tú estás buscando hacer un segundo tummy tuck, ¿ok? Si por ejemplo, tuviste un embarazo luego de ese primer tummy tuck y el músculo se volvió a separar, tuviste una ganancia y una pérdida de peso que ahora tienes piel en exceso, pues se puede hacer otro tummy tuck, ¿verdad? Se puede remover ese exceso de piel, se puede volver a reparar el músculo. ¿Cuántas veces? Bueno, ya después de la segunda vez se va poniendo más difícil la cirugía. ¿Por qué? Porque ya de seguro no tienes tanto exceso de piel, la piel ya se ha estirado 2 veces, el músculo va a tener mucho tejido de cicatriz de esas 2 reparaciones. Eso todo depende de qué. Y lo otro que es importante saber y considerar es que he tenido pacientes que vienen a lo mejor con 1 o 2 tummy tucks y liposucción y me dicen, pero es que la barriga sigue grande y yo quiero que la barriga esté más plana. Y hay algo que es importante saber, que es la grasa visceral. Hay grasa que está dentro de nuestro abdomen, alrededor de los órganos, que esa grasa, la única manera de perderla es perdiendo de peso. O sea que siguiendo haciendo cirugías no vas a obtener el resultado que estás buscando si lo que el problema es la grasa visceral. Así que es importante que si ya has tenido cirugías y es importante que te evalúes con un cirujano plástico, para que en esa consulta se determine qué es lo que está causando lo que no te gusta y cuál sería el mejor procedimiento o el mejor caso para ayudar en tu caso particular.
Hello, Dr. Vidal. Can I request an expert shot for a BBL?
So I usually don't do it for a BBL. You can request it, and what I can do is put it in your tumescent fluid. So when I'm injecting it, it'll distribute on the tumescent fluid, and we can do it that way. The only thing is that because of the limitation of the amount of Exparel or lidocaine that it can be injected, it can only be 1. Okay, but yeah, it's a possibility.
The last question: what position after making a year from a mommy makeover would you to sleep in? Say avoid? Would you avoid? Because there are
the
3
position
letters.
to sleep after
Yeah.
mommy.
Yeah.
So
1 year after mommy.
After 1 year after a mommy, you can sleep in any position. What I tell my patients is for the first 6 weeks, Try to avoid sleeping on your sides, okay? And sometimes if you did breast implants, after 3 months, you shouldn't be applying pressure directly on the breast because that capsule is still healing and you can stretch the capsule and then the implants can move laterally. So for the first 3 months, try to avoid sleeping in your chest, but after 1 year after the surgery, everything should be healed enough that you can sleep in any position. That's it, you guys. Thank you so much. Hope this helped to answer a lot of your questions regarding BMI requirements and the difference between surgeons, and to know what are my BMI requirements and why do I think those are the important considerations. And I'll see you guys next Tuesday on Tuesday Tips. Take care. Have a great weekend.